Well, good afternoon. Good afternoon, everyone. Thanks for joining us today. We find that we already have about almost 50 participants. I think with a few more minutes, we'll have more. Just by way of introduction, this is part of a series of webinars that we have been doing from WRI-India on what we call the Build Back Better series, the post-COVID Build Back Better series. And while we've done few focusing on agricultural reforms, on nature-based solutions and all that, this one is focused on restoring public transport. And the point is, as the economy starts opening up, it's absolutely fundamental that public transport systems need to operate, because without them, you really can't have an opening up of the economy. So public transport is critical. And there are issues that come up around the safety of public transport systems for people moving in them. The compulsions more for the public transport system itself, because they have over the last 3 months earned nothing, yet continue to spend almost 60% of their costs continue to be incurred. As they open up, they'll probably be spending all the money that they have been spending earlier, perhaps a little more. Yet the revenues will be lower than earlier because you have the compulsions of keeping people at a bit of a distance. So the ridership levels will be low. In that situation, what does restoration of public transport really mean? And really, this is the point of the discussion today. And fortunately, we have a very good list of speakers, critical, people who've been leading a lot of work in this sector. Let me just introduce them one by one. Let me start with Prasanna Ganesh. Pras is currently the Program Director for the Toyota Mobility Foundation, responsible for the Asia Pacific region. He's based in Bangkok and he's joined up from there. In this role, he is overseeing 3 projects in Thailand, Vietnam, and India, primarily on issues relating to multimodal mobility. And he was instrumental in our being able to take up a project for facilitating last mile connectivity to the metro rail systems. He started with Bangalore, then moved to Hyderabad, Kochi, Bombay. And that's been a very interesting project that Pras really helped us put together. So that's Pras Ganesh. Then we have Prasanna Patwardhan. Prasanna is the Chairman and Managing Director of the Prasanna Group. He's been a operator, both a tour operator and a city bus operator. He's really led a lot of the private sector operation of city bus services at a time when this was at early stages, sometime around 2007, 2008, when we were really looking at a lot of private operation of city bus services. Prasanna was one of the leading people there. More recently, he has set up a massive Bus Operators Confederation of India. Their events that they do in Pune and Mumbai are to be seen. Thousands of people. Prasanna is the president of that confederation and really has been at the forefront of looking for reforms in bus systems. We have Mr. K.R. Jyotilal. Mr. Jyotilal is the Principal Secretary for Transport in Kerala. He's, I've seen him always so full of enthusiasm, so full of energy. I envy him a lot. But he has a BTech degree from IIT Madras. I feel very happy about that because that's my alma mater myself. The only thing is he got into the IIT when it was a lot more difficult to get in than when I got in. He also has an MBA from the ICFAI. He's been leading the charge on electric mobility in Kerala and of course is responsible for all of transport systems in Kerala. That's Mr. K.R. Jyotilal. Then we have Mr. Ajay Seth. He's currently the Managing Director of the Bangalore Metro Rail Corporation. He's, like Mr. Jyotilal, also an IAS officer. And I've had the privilege of meeting him on many occasions. And frankly, with him at the head of the Bangalore Metro Rail Corporation, I think it's in very safe hands. I've enjoyed a lot of discussions with him. That's Mr. Ajay Seth. Then we have Mr. Chandramauli Shukla. Chandramauli is currently the collector of the Dewas district in Madhya Pradesh. He was earlier the CEO of the Bhopal Smart City Development Corporation. I have seen him from the days when he was a sub-collector in Indore and was really responsible for putting together a very interesting private sector-led bus operation system in Indore. That really got picked up in many other cities, not just in India, but also in many other parts of the world. That's Chandramauli. Finally, our greatest friend that we have here, Sahba Chauhan, is the Program Officer for Climate and Energy in the Oak Foundation. She's a climate expert with over 15 years of experience with not-for-profits and with philanthropy in Asia. She has a master's from the Himachal Pradesh University and in policy studies from IIT Delhi. So thanks very much for all of you. This session will be moderated by my colleague Amit Bhat. Amit leads all our transport work in WRI-India. Amit and I have worked together more than 10 years ago. And then we, of course, went our different ways, but then have come together. And Amit is again really the leading light in WRI. And it's really a measure of his enthusiasm and his energy that the transport program in WRI has moved so well forward. So with that, let me complete the introductions and let me pass it on to Amit for moderating the session. Over to you, Amit.
Thanks a lot, Dr. Agarwal. I think if we summarize the current state of affairs in one sentence, I think it would be basically the reduced need and the increased fear of contamination has led to where we stand in terms of the ongoing crisis that is surrounding public transport. And so I think today we are having this very interesting discussion where we want to build back, but build back better, which is also the part of our series. And how do you basically resume public transport services? One, I think in the recovery phase, which we are currently experiencing, but also to look at public transport in a post-COVID scenario. So I think with this, let me first go over to Mr. Jyotilal. And my first question to you, sir, is that we have heard a lot about Kerala and the great work which has been done in Kerala on COVID. But tell us something about public transport situation in the state.
Thank you, Agarwal sir and Mr. Amit. In fact, Kerala, I've been heading the transport as well as the general administration department. Probably I was heading the war room for the Kerala. So one of the key challenges which we found was the first one was in a war. First thing is you need to ensure the food. So truck movement to ensure that part we could do it in the first 2-3 days. That was a real challenge. Second one comes the movement. See, the cities come to a standstill if you don't allow the public transport. The main demand was that the people, nurses, maybe those people works are made. They need to come from outside the city. Without a public transport, even we were also managing with the private transport. We used to send the vehicle. It's it's not economically viable at all for a city to sustain without a public transport. So then what we allowed is within the city we allowed the public transport. Then between the districts, up to districts, between the districts we allowed. Probably next stage is maybe interstate movement. So the number of private vehicles have gone up like anything, probably because when you stop the public transport. But the main issue is that even if you allow that, the cost is going to be so high, the city will not be able to sustain. So that, then second is the transportation for the migrant workers. We have got almost more than 4 lakh people which need to be sent. So we have been using the public transport as an effective tool for bringing the people from various places to the railway station. Then the people who are coming from the Gulf, we have got more than almost more than 3-4 lakhs people who are already registered and are coming by chartered flights as well as the Vande Bharat mission. For them to be taken to the quarantine center, you can't force them to pay. So public transport was used as the most effective tool to take them to the quarantine centers. Like that, people coming from the domestic flights, they were also transported to the quarantine centers in that. So the need for public transport, the advantage is you can't you can't manage it so well unless you have got a system in place which can take. But one issue which we found was the social distancing. If you allow half the seats only to be filled, naturally you need to increase the fare. Actually, we are the first state to increase double the fare. Initially doubled, then later on we said, okay, 50%. Now we said that in the flights and the train, you are allowing everyone to go. Only thing you should wear a mask and put the sanitizer. Why do you want to restrict the numbers? We allowed the numbers to be, all the seats can be filled. So it's a great opportunity that we are in one way. In fact, now we are trying with something called a contactless. You see, the cash is where you can contact comes. So you avoid the cash, go digital, contactless cards. And then we did a pilot with our secretariat employees. All of them, almost 450 of them took the prepaid cards, contactless cards, and it's working very well. So that means go digital, go contactless, and maybe since you are allowing no standing passengers, that's a good opportunity. Everyone can book the seat. Now, initially when we started, the half seats only can be filled. People said, no, I have to wait for another half an hour to get the bus to come back and pick me up. So then they said, okay, you can book your ticket in advance. So I think mobile ticketing is another next opportunity thanks to COVID. I think I see it as an opportunity. I think a lot more things are there. Probably I think I will limit it for the time being now. So it's actually the only system changes when you are thoroughly hurt, thoroughly bored, or a transition event happens. I think all the three happened now. So it is to be seen as an opportunity to bring it back. Yeah, thank you.
Thank you, Mr. Jyotilal. And I think the phrase that you use is the phrase of social distancing. So on that note, let me request Mr. Ajay Seth to come in. Sir, as a managing director of a large metro company, and one is that, do you see the COVID crisis impacting people's faith in mass transit? And if so, how do you foresee overcoming this challenge?
Amit, new normal. Again, the time horizon is important. Are we looking at short term over next 3 to 6 months, or we are looking medium to long term, say 1 year to 3 year or 5 year kind of scenario? At this point of time, as you noted, the fear is pretty high, and the attempt or the thinking at the government level, my sense of what Delhi is advising and what sense I get it, what the state government of Karnataka is also advising, open up the economy, open up with confidence, but take all measures. So social distancing in the short term, and I'll put it over next 6 to 8 months, is part of our life. And that is something as transport operator, we cannot let that go. Because whatever it happens, we have to manage and strike a better balance between opening up as well as public health measures. Now, in the beginning, OP sir said that 60% is anyways a sunk cost. We keep on spending it. But even when we open up, we will not be earning 40%, the balance 40% cost with our revenues. Revenues are going to be like mass transport, whether bus or metro, efficient. But at the same time, we have to observe the social distance. At no point of time, the session is we should not open up, because rightly put, economy to open up, public transport is an integral part. So there will be losses, and hopefully with public transport agencies, government will give a helping hand. So we have to open up with that, but not let go social distancing be sacrificed. But other measures in terms of making sure that the people are screened when they enter into our system. Metro has an advantage vis-a-vis the bus system because the entry and exits are regulated. So it is much easier to examine, like do at least a basic temperature check, sanitation, etc., which can be provided. So we can take a better care. But that is something which will have to move forward. But on medium to long term, this is something which we need to think it through. Whether this pandemic is going to be with us for 1 year or we are looking for a longer term. Whether the social distancing, new normal, is social distancing is a medium to long term phenomena or is a short term phenomena? Because if it is a medium to long term phenomena, then perhaps the entire society's outlook, the entire economy has to undergo a change, that how the economic activities get organized. So somewhere my sense is that we should start debating or rather brainstorming that process, that what does new normal means in terms of policy, in terms of the action, and what it means for a public transport. Because if It is a short-term social distancing, things can become normal. Then it's a new normal will be the old normal kind of thing. But if social distancing is a long-term issue with us, then the way we move is also changes. That has a much deeper implication for public transport. Thank you.
Absolutely. I think absolutely spot on in terms of looking at the social distancing as a short-term or as a medium to long-term phenomena. And I think on this, let me bring in Sahba. Sahba, you've been leading a big philanthropy community. I just wanted to understand, in the philanthropy community, this whole work from home, is that being considered as a new normal, or do you also thinking that this is a temporary phase and then eventually people will go to office and life will start as it was before?
Well, it's a hard question to answer because in some places it has. A lot has depended on how governments have reacted to early, warning signals on COVID, and I think so. One of the things that I wanted to introduce to your audience is that I work for a philanthropy that is a climate philanthropy at its heart, and we have been working on making non-motorized transportation and public transportation much more popular amongst the youth, amongst everybody. And we've seen that in India, there is already a lot of public transportation use. So I think in terms of our response and our climate philanthropy's general response, yes, absolutely. We think that this is a huge crisis. And if any of you have read the Guardian report today, we have really 6 months to address climate and not the 10 years that we were thinking about. So from a climate response perspective as well, I think there needs to be a lot of attention, and thanks for the speakers earlier to pointing this out as not just as an essential, but also as a great opportunity for innovation. I think the thing about that, we will lose a lot of money when people will not come on public transportation, and doubling the tickets amounts and all of that to save some of the investors. I think that needs to be relooked, because from our perspective, public transport should be free, and it should be safe, and it should be a non-negotiable. It should be the biggest public demand. It should be safe, and I know WRI has been also thinking about these things. That's why we support the organization such a big way. And so we have to put people in the center. We have to put safety in the center. We have to find innovative ways of financing public transport. Amit, you sent me that message earlier about working from home. Who can really, free up those seats on the public transportation, and who needs to get to a hospital, who's a frontline worker, how can we ensure their safety? So when governments will start thinking like that, I think the public messaging will change. You have to do a lot of awareness raising campaigns, and you have to find innovation and alternatives. I think that is the thing. Some of the cities had the COVID crisis happen before there were cycling routes, before, some cities had walking pathways. It would have been even harder, and we are finding in more crowded places, in places that already don't have public transportation, the last mile connectivity, that is where the crisis is much more deep. So I think we have to separate these issues out. And public perception is also very different. Some people just have to get to work regardless of the risk. I have a friend whose father was a bus driver in the UK, and passed away from COVID ferrying people to a nearby hospital. So I think we have to recognize public health, public transport service providers as essential workers, and ensure their safety as well. So I think I would, my comments really would be around designing a system that's focused on safety and people.
Thanks a lot, Sahba. I think two really important questions that you raised. One, I think innovative financing, and second is the whole frontline worker. So before going to the innovative finance, let me bring in Mr. Prasanna. So Mr. Prasanna, can you summarize quickly in terms of what's been the impact of COVID on bus operators in general? And since 90% of the Yeah, Mr. Prasanna.
Yeah. So as far as private operations are concerned, we have varied kind of situations because we operate in multiple kind of services. So for first 2 months, about 98 or 99% services were off-road. This month, about 95% services are off-road. So different services has got different kind of impact because of COVID. So starting from first, say, public transport or stage carriage operations or point-to-point operations, everybody is talking about social distancing, and social distancing is important. But at the same time, we need to understand, if we keep social distancing, how many operators would survive? And who is going to bridge that gap between income and expenditure? Today, with normal, which was 3 months back normal I am referring to, many of the public transport operators used to lose thousands in spite of full capacity utilization, over capacity utilization by 100%. Now, with 50% utilization, which means 25% of the original utilization, how they would survive. So that needs to be thought of very well. So on the one side, you have option social distancing and seeing that people don't operate, or other side, you have option like Kerala, wherein social distancing not followed, but operations are in place so people can have access to their livelihood. So that is about public transport. Private operators will not be able to operate with social distancing norms without government support. Government support is in shortage even for state transport undertakings, forget about private operators. So that is one case. Second case, when it comes to school, many of the schools, they have declined to increase their children's fees and even transportation charges. So who is going to pay that transportation charges? So they said, you take it from parents. How many parents are in a position to bear those kind of charges? So that is also a challenge, because parents do not have money. Many of them have lost jobs and many of them have taken pay cuts. So we have given suggestion that they can have deferred services. So one bus can be utilized for a more number of shifts, etc. So there you will require some regulation changes wherein you can take children from different schools in the same bus. So that is also one of the suggestions which we have given. So there you have different challenges. Some of the schools, they have said, we will ask. So imagine at 7:30 in a school where 1,000 students are coming, 1,000 parents are coming by their 1,000 vehicles. What is going on? And same situation is with companies, because companies are also feeling it very difficult for payment of double the charge for each employee, and school transportation is again in a problem. When it comes to public-private partnerships, in public-private partnership, many STUs, they have taken a stand of that because of force majeure, we cannot pay you. So under these circumstances, what private operators will do? How will he pay? How will he survive? So this is also a serious challenge. And after that, when you come to actual tourism is almost over. So what do we do with those buses? And here in cities, I believe once everything opens up, you will have shortage of buses in the cities if at all social distancing norm continues. So these tourism buses can be utilized for city buses or even employee mobility or wherever there is a shortage. But if social distancing, question is whether private operator would survive or not survive, whether they will be able to bring in their buses on the road or they will not be able to. So this is overall situation of private operators in the entire lockdown period, and moving forward that what stand government takes in each state. Like in Kerala, probably because there is no social distancing norm, private operators they will be able to, even with less number of passengers boarding the buses. But at other locations, it seems very difficult.
Thank you, Mr. Prasanna, for highlighting this. And now I think Mr. Chandramauli Shukla is with us, the collector of Dewas. So, Mr. Shukla, we were talking about formal public transport, but I think Dewas must also have a lot of informal public transport. So how is COVID impacting the informal public transport in cities, if you could highlight?
Hi, Amit. Hi, Prasanna.
Hi.
Let me clear it out. So informal public transport in a smaller cities like what we have in Dewas, is less of a public transport, but more of their own business. So the current scenario for the Dewas is like the city that the operators have already started operating. Of course, the norms which are given by the government as of today is to operate with a capacity which is only 50%. But as they have been in lockdown for a very long time, so they are not looking it as a public transport. They are looking it as something as a mode of survival for their family. So they are trying to earn money. So the kind of informal transport like Magic and even the autos, they have started operating. But the second part is the government has also asked us to start operation of the intercity buses from one district to another district. But the rider is that it has to be with the 50% capacity. Now, two things are important. One, you have to look where are you located. So Dewas is located some 40 kilometers from Indore, some 40 kilometers from Ujjain. Both the cities are like highly COVID affected cities. So but even if one town wants that we want to operate, but then the other town will say, okay, we'll not allow the buses of one city coming to the bigger city, which is red in June. So that's the problem. Secondly, it's true what Mr. Prasanna was telling, that operators don't want to operate with a 50% capacity because that's not viable. So we really want to find out some solution wherein the commuters of a smaller city can go for work to the bigger city which are adjoining. So I can give an example that those who used to go to Indore or to Ujjain for work from Dewas, they are not able to use the public transport because one, the operators are not ready to operate at a 50% capacity, and second, because there is a fear of the district administration as well as the administration on other part that probably the commuters will help the kind of the spread of the disease. So it's just not only the public transport as of today. It's a more of earning for their families and also operating within the current guidelines of the government.
Thanks a lot, Mr. Shukla. And I think you really highlighted the importance. It's basically just survival at stake for a lot of small transport operators. So on this part, let me request Mr. Prasanna Ganesh from TMF. Pras, if you could share some example about the essential transportation essential services like healthcare personnel and all in this COVID crisis.
Okay, thank you very much, and thank you for having me. So especially when you ask questions to Prasanna, there are two Prasannas. So each time I thought it was for me when we were asking the other Prasanna, but thank you very much anyway. Maybe actually, rather than me first starting, is it possible for me to ask Kavneet to just show a short video to all of the people related to essential service transportation? We have a small video that we have prepared, and we can just show you that right now.
Can you see my screen?
Yes, Kavneet, go ahead.
Sure.
Can you increase the volume?
So thank you very much. I think that video just gives you a bit of a kind of image in terms of specifically looking at essential services and what we had to do. And this is just giving an example, but what Toyota Mobility Foundation kind of worked on was we recognized two things. First of all, essential service workers are at higher risk, and not only for themselves, but also in terms of potentially getting an infection and then spreading it to a broader public as well. So from that perspective, we also felt that if we are able to provide some kind of service for them, we will also take them out of public transportation in some ways and allow them to go from home to wherever they are working and then back. So in that context, we were considering two main elements of kind of service for these workers. The first one is really about sanitization. So we wanted to try to create the hardware which provides them with a sanitized service. So as you could see, there are a couple of things that we did. Of course, we put a separator between the driver, because the drivers also, some of them were a bit worried about taking and picking up these essential service workers. We have to respect the fact that even drivers do get concerned about these kind of things. So in that context, putting the separator between them, and then also looking at putting like plasma clusters or nano-E, which are kind of in some ways, sanitized to help purify the air. And then we did like seat covers, which are disposable. So we were trying to change that frequently. And then we do a sanitization service for these vehicles also a couple of times a day. So we do this fundamentally 3 shifts to try and bring these people to their work and then take them back. And the second element, which is more from a software side, is really that we try to make sure that it's on demand. What this basically does is, of course, it allows us to pick these people up from their home, bring them to the hospitals, and then take them back. But then very importantly, because especially essential service workers right now are not keeping normal shift hours, they have to work longer, they have to work maybe very, very difficult kind of services, which means sometimes they cannot predict their own time. So of course they have to get into work at the same time, but maybe the time they leave work is quite different. So in that context, to try to give them an on-demand solution, which means that they would actually then be able to specifically book when they need to go back, and then we would be able to group the demand together and take them back. So that was kind of the critical element of putting the software in. But it also does another completely different element, which is it helps us with contact tracing as well. So once you actually have this service, you can then clearly understand the contact tracing route. We actually kind of rolled this out now in Bangkok. We rolled it out in Jakarta. We rolled it out in Manila, and we rolled it out in India as well, in Bangalore. So this kind of service is what we are trying to do for essential workers. Of course, there's a limit to how much we can cover, but this service was provided by us essentially with the context, and then we kind of created a standard procedure which we shared with anyone who would like to utilize this, including sanitization standard operating procedure, equipment standard procedure, which is freely available, and we can share it with anyone who wants it.
Thanks a lot, Pras. And I think the importance of having a standard operating procedure on how do you kind of make the services safe from the COVID perspective is something which is very interesting. Now, let me just ask Mr. Jyotilal, I think let me combine these questions together. One, I think if you could also elaborate a little more in terms of what are the safety protocols that the government of Kerala is planning for public transport. But also, in your opinion, can this COVID crisis be used to reform or to bring the much needed reform in the public transport sector?
Thank you. In fact, one of the things is the personal protection to the drivers and the conductors. That's the key, because 2 of our drivers also got COVID because they have been transporting more than, I think, probably 4 to 5 lakh people have been transported through public transport. I hope you are able to hear.
Yes, we can hear you, sir.
Yeah, so that is the key. Safety of the people who are involved, the drivers, and the second is safety of the passengers. Sanitizers and mask is made compulsory. Otherwise, the police can book and minimum fine is 500. So I think now it has become a new normal. Everyone will start wearing it. So third one is the separation. Probably that we need to spend something around 5 crores to put the great separation of separation between the driver cabin as well as the Only thing we tried with plastic, but then the issue is that, you know, if it is air conditioned, then we can put it. Otherwise, because the wind, it is all getting blown up. So second point, which what we thought was contact is, how do you eliminate contact? One is cash. So you go zero cash. Actually, our motto is zero cash, so that you go digital. Either so we are in work with we are in touch with banks also. Actually, we did a pilot with Chalo on and around I think 15-20% penetration has happened in the last 20-30 days in the routes from Secretariat to nearby city, what is the towns. So one is go digital, so that, or you go for a mobile ticketing. And second is, there are three categories. What I talk to the banks is, I have got 1 crore people which are driving license. Convert that into under the One Nation One Card, NCMC card. So the standards have been made. One side you will have driving license, other side you will have a prepaid card. Up to 10,000 rupees RBI allows you to have a prepaid card. So there your what is the KYC, your mobile number, all your contacts are there. One of the key success why Kerala could control is contact tracing from the day one. If you come by flight, I get the entire passenger manifest, including your mobile number. Then I track you before you start the journey. I find out which is the village, where is you are going to leave, his house, every number is there, local bodies, the local police station, everybody is going, the entire chain up to your transportation, up to the your house, and maybe 14 days. Earlier we used to start with 28 days. We used to monitor, and we put a notice board outside the house that this person is under quarantine. So the community also keeps a check. So key thing is contact tracing. That means you need to have a card which, so driving license people 1 crore can cover. Students, I will give card, prepaid card, which will through the institution, that covers the remaining. Remaining maybe 1.5 crores I need to go. So we are in touch with the banks to issue a card free. The banks can use the float. I mean, this card is 100 rupees, and probably you can top up with every 10 rupees extra. You can top up with the minimum of 10 rupees. We trained our conductors, they were able to handle it. So second is, next is POS. Then we talked to the MasterCard Southeast Asia head. See that now mobile itself is a POS. Then we talk to the banks. I want to integrate a driving license, we call it Godson travel card. You come to Godson and you buy this card, you can do shopping, you can travel, you can do everything, and when you go by, it's like a mobile. So I am talking to Airtel. See, you have got a virtual SIM. You integrate the SIM so that I need not ask him any KYC. You have the SIM also, so you can track his movement also. Give him 4G SIM. So all the people who have come from Gulf, we gave them 4G SIM free. So we know how, if he comes out within 300 meters away, if he goes out when he's under quarantine, we get the alert. Nearest police station will take care of that. So it's a very good system. Technology can really change the world. One is contact tracing. Then you can make a contactless after some time. At least long distance buses can go contactless. So mobile ticketing, contactless cards, NCMC integration with your mobile, and link with your mobile. Wherever is a prepaid card, link it with mobile. You need not ask any further questions. I think that is what, and then maybe zero cash, zero congestion, zero contact, and maybe zero emission. That's a motto. I think we just begin, and it's a good opportunity, because in the name of COVID, we will be able to make it happen. So people have accepted. Yeah.
No, absolutely, Sai. I think absolutely you pointed out that we can really reform the public transport system using COVID as a crisis. So on this part, let me ask Mr. Ajay, Seth, who's the managing director of Bmrcl. So two questions to you. One, any special precautions that the Bmrcl is planning for safety of passengers? And linking to that is, when, in your opinion, when do you think Bmrcl would be ready to start operations?
Okay, the second one is the easier one. First one is a difficult one. Our preparedness is that on, say, a 3-day notice, we can start. For all these 3 months, we have kept the system fully operational, fully powered on. So in fact, morning, evening, we run a test train to check our system, and those systems are ready. Now, coming to the first question, that what special precautions are there? in near term, we see that social distancing we have to operate. And I fully agree with Mr. Prasanna that it is difficult for public transport operators, whether owned by government or the private operators, to manage the losses. That is a separate basket which has to be taken care. But social distancing, we must. So the idea is at no point of time, metro operates at more than 20% capacity, because the 20% itself, leave alone 2 gaj ki duri, even 1 gaj ki duri will also become a difficult one. We simply can't afford to let go the social distancing aspect in the short term, if you were to say. So the special precautions which we have, that all entries, people without mask don't come in. That is first requirement. Second, we make it available hand sanitizer, all of them, at the entry point and again at the exit point, which we make that available. Then alternate seat only to be occupied. And in fact, we have put in stickers in our coaches that which are the seats are not to be occupied. And in the middle row, which is a standing row, again marking it on the ground where the people have to stand. So in fact, a typical metro coach can comfortably take about, say, about 250 to 300 people. But what we are operating, what we are planned for, is to operate it not more than 60 people to a coach. And the driver, with modern technology, the train operator gets to know what is the load. He gets to know if there are more coaches, more people in the train. And so we have also done the work that if train has got overload and we find that there are more people waiting into a particular station, the train does not stop there. We don't take people there. And the last one, regulating an entry, that no platform can take more than 50 people at any point of time, because our overall capacity on a 6-coach train, what we operate in Bangalore, with a reduced capacity would be about 350. So at 20% capacity. So these are the precautions which we take, make that available. So as a government-owned public transport agency, we see our role in the short term as an enabler of unlock operation. Thereafter, post 6 months, then we'll have to get into look at here that how do we then try to ramp up the utilization. Thank you.
Absolutely. I think interesting point in terms of managing the passenger load to a certain level to maintain social distancing. So on this point, let me ask Mr. Chandramauli Shukla. Sir, I mean, we've heard that social distancing, whether it is buses and train, while it is tough, still manageable on the vehicle side. But how do you apply social distancing, let's say in a bus stop where people are waiting? Because there we are seeing a lot of crowding happen. So how do you actually operationalize this whole concept on ground?
So either the question is or the answer is, do we really do it? So we have been talking about social distancing. It must be very tough in the buses, but once the unlock has started happening, and the people have been in their houses since last 2.5 months, with the economy just have started. Say, for example, if I talk about Dewas, we have just paid the farmers the money for the procurement which we had done for the wheat and the gram. So now the people in the rural areas are having money. They want to come out to the city, and they are really coming out in large numbers. Say, for example, a person in motorcycle with his wife, a son and a daughter, they'll come all along to the city. Whatever you do, whatever you try to do, ultimately, a lot of influx of the people coming to the smaller towns and definitely to the bigger towns that's happening. So if somebody is saying that we are seriously enforcing the social distancing especially, that's really not happening to a major extent. But what we are trying to do is, one, to sensitize the people through the various stakeholders. When I say for example, we have allowed all the shops to open from Monday to Friday. So it is important that if only the government is trying to enforce the social distancing, it probably may not be possible. But if everybody comes on board, say for example, all the shop owners, so anybody who's into the trade of selling clothes, that particular association should issue its own SOP and what we have done in Dewas, or most of the cities have done in Madhya Pradesh, that every association of a particular trade has its own SOP to ensure the social distancing. Normal sensitization, normal IEC activity to do that, it's done at the national level, it's done at almost every level. Most of the social organizations are trying to do it. It is happening, but it is not happening as it should happen. So this is true. Secondly, as a part of the administration, apart from sensitizing people and sensitizing organization, there has to be an element of fear also. There are two kinds of fear. One, the fear of the disease that can spread, and that will not only spread to a particular person, but to the entire family. And secondly, the fear of administration, that if you not follow the norms of social distancing, there can be challan. If you do not, if a shopkeeper says allows a shop to or the people to come in large number of the people, then there are certain punishments already defined in the SOPs issued by the Government of India as well as the district. So I'm not saying that entire administration should go and invoke all the acts of Disaster Management Act, Epidemic Act, Section 188. Not everything is required, but you have to make sure that people are little afraid of facing these kind of actions when it comes to enforce the social distancing norms. So I think it's a combination of all. It's happening to certain extents. It's not really happening the way it should happen. Administration is trying two things which are totally antithesis of each other. One, they want to unlock the city, and also they don't want people to come to the shops. So this is actually happening. I don't know how other cities are doing, but it is little manageable in smaller cities like Dewas. When it comes to something like Delhi or Mumbai, I don't know what the story is there.
No, thanks a lot, Mr. Shukla. I think this is very interesting because on one side you are saying don't come out, but other side you are saying the lockdown is over and the economic activities should start. So on this question, Mr. Prasanna, if the economic activity has to start, I think the public transport has to scale up. With the current level of deficits that we are looking at, as a chairman of BOCI, how do you think we can revive public transport? What can be the physical and non-physical reform that can be brought in to revive the sector? If you can unmute yourself, sir.
Pardon? Amit, is
Am I audible?
Yes, Mr. Prasanna, you can hear.
First thing, what kind of social distancing norms we should have, because that is the most important question which we must ask ourselves. Apart from city bus operations or intercity stage carriage kind of operations, in other operations it is possible, like in schools possible, employee mobility, other luxury services, all that is possible. But in a city wherein even today, you must have seen some clips of Calcutta, wherein people are just sitting inside the bus. So stopping people to board the bus is so impossible that riots will happen on the bus stops. So you cannot stop people from boarding the bus. So you can have a law, you can have regulation, you can have enforcement also. But in a country like ours, wherein even about 15 days back, Pune was opened up where I stay. So people are moving on two-wheeler without masks. So how many police you can deploy, how many people you can check? So there is some limit to what we can do. So we can have some good intentions, but converting that good intentions into reality is very difficult in our country. That is what is our experience. So we should come out with something which is possible. So first thing is that what should be SOP, what kind of sanitization, mask wearing, what partitions between two passengers, etc. What needs to be to have a standard SOP and which need to be followed and which has to be a practical SOP and not theoretical SOP which cannot be followed. So that is one. But coming to financial situation, I think this particular thing has brought in different kind of opportunity for us. People should, or government should look at this as opportunity to totally revamp public transport. And we are discussing for last several years. It is high time that national institute which takes care of public transport needs to be established at national level, state level, and even local level like UMTA. Because to regulate all this, who is going to decide what is going to happen? So there has to be some institutional framework which needs to be from long-term perspective. This, whatever we decide, is not going to happen. Then second, I think that when we say social distancing norm or what we need to follow, we also need to understand that we need to give people access to their livelihood. If you deprive them of having access to their livelihood, they will go there in whatever way possible. So if you do not give them public transport, they will cling on to each other and go there. So on one motorcycle, five people can go, but they will ensure that they reach that stop. So you cannot stop them from going there. As far as our requirements are concerned, I think from financing point of view, we are not expecting government to fund us like how they are funding to STUs. What we are expecting is government should waive off some things which are in their hand. Like for example, so there are certain things like toll. So toll, suppose if waived off today, by increasing their contractual period, that can be recollected by toll operator in future. Same is the case with parking lots or bus stations. So there are some things which government need to only facilitate. And from that, existing infrastructure which is lying idle, that also needs to be utilized properly with STUs, and even there are empty parking lots. So all these things need to be brought in together, and all operators under integrated system, whether he is public operator or private operator, all of them should come together, decide what kind of services we need to provide under this condition, and this is the best to decide this and start providing those services under standard norms. If that happens, then most of the things will come back to normal. As far as our debts are concerned, we are saying that this contributes to large chunk of our expenditure. Motor vehicle tax and passenger tax contributes to somewhere between 5% to 17.5% of our revenues. Then toll contributes to 5 to 8% of our revenues. Diesel, taxes on diesel, which is cess and excise, contributes to about 20 to 25% of our revenues. So all this put together, our money goes by way of, and plus GST. So all this put together, we pay almost 35 to 40% taxes. So we are not expecting government to give us money, but we are expecting government at least take money from us. So if they waive off those taxes, lot of people will be comfortable in operating their systems. Otherwise, you may come up with any kind of regulation. If there are no operations, actual whatever we are expecting to happen after open economy will not happen. Second thing, what we are expecting is banks should support in this time, because only two institutions can support during this crisis. One is bank and second is government. So bankers have given moratorium, but they have not waived off interest. So waiving of interest is equally important. And on top of that, not only waiving of interest is, I would say, is okay, but reschedulement of entire loan is also very, very important, because without reschedulement of loan, if they are going to ask me full EMI, which I was paying last year in the month of September, not many people will be able to pay that kind of EMI. So rescheduling, which is matching our cash flows, which is ballooning kind of rescheduling, wherein initially you dollar money and then afterwards you take more. So that is also which is required. And same is the case with insurance, wherein we say that insurance third party claims are almost zero because of lockdown. 95% vehicles are outside, lying in the workshops. So our extension of this policy has to be done to the equal number of days, like 3 months or whatever those months we are under lockdown. And under public-private partnership, I believe that government should support STUs to pay private operators, so that private operators also survive and they are able to provide services going forward also and don't go bankrupt during this crisis time. So these are some of the things which we ensure. But coming back to our own thing, what we can do by ourselves. So I think when we should collaborate with each other rather than competing with each other. When I say we also mean including metros also, because you should not run parallel services to each other and compete with metro competing with BRT or city bus services, or each is competing with public. So there are different kind of competitions which are going on amongst ourselves. So we need to actually come together and decide what needs to be done. And as Mr. Jyotilal said, it is equally very, very important to go digital. Use of maximum technology is very, very essential. Usage of technology, there cannot be a contactless situation. And even in sanitization, we have come up with, we have received quite different kind of coatings, then different sanitization processes like ultraviolet rays. So there are different kind of technologies which are available. So we should use technologies to maximum. And last but not the least, I think this paratransit or informal operators should come together like aggregator. There are multiple different kind of aggregations which can happen. When I say aggregator, please don't quote me like I am saying that Ola or Uber kind of aggregation. Aggregation can be done by unions. Aggregation can be done by STUs. Aggregation can be done by all these paratransit. If they come under even STU banner and STU takes them under their wing and use them as supporting their trunk route services, or wherever there is a shortage of services in terms of frequency because of bigger buses which they use, they cannot have on certain routes. So use smaller vehicles, take operators along with you, and see to it that everybody survives. So aggregation model in terms of all of us coming, all small vehicles coming together and working in systematic and with the help of technology, they give better services to people. Thank you.
Sure, Mr. Prasanna. And on that, bringing together public-private, let me ask Sahba. Sahba, my question to you is slightly on the broader perspective. Do you think this COVID crisis is questioning some of the fundamentals of city and transport planning, be it public transport, shared mobility, or even densities that we are talking about?
Yes, and I think it's not just that. I think it's just also questioning what the whole economy, what is considered as an essential work, what is considered as necessary for the economy of a city or a state to run. We haven't had these discussions before, but it's also, an interesting point to say, how do we use innovation? What are our goals as we design a post-COVID world? Is it going to be based on, preparing for another pandemic? Is it going to be, building back better, as is the theme of your seminar, or is it going to go back as soon as the crisis resolves, or people learn to live with it? Are things going to go back to what it was? And our persuasion is that it should not. Things should not go back to normal. We need to restore not just faith in public transport during the pandemic, but faith in public transportation in general. We have to make it safe, we have to make it more efficient, and we have to make it really cheap, and we have to make it free, as I would say in most cases, because unless you do that, you're going to you're going to have a scenario, and that would be a really, really bad scenario to be in, where the emissions will rise. I will kick back in sort of with full force. We'll have much more air pollution. We will have people having difficulty paying for, what I would say private public, it's probably not even a technical term, but for me, public transportation is transportation that's serving the public. And, and private operators in that have, clearly, as you've said, have a key role to play. But if you end up in a situation that public transport gets even more privatized and even more deregulated to support, kicking back of the economy, then you have a problem. You may have much more innovation, but that public transportation may not be affordable for the public. So I think those are really the broad perspectives as philanthropy we are really, really concerned about.
Thanks a lot, Sahba. And let me just ask a follow-up question to Pras. Pras, do you think this COVID crisis is going to fundamentally change the vehicle design that we are looking at in terms of form factor, seating, and things like that?
So fundamentally, I believe there will be some elements that will change. Some elements probably will not change. I think the critical thing that will start becoming more common is the air purifier or the filter. You will start seeing different kinds of filters being utilized, which are to the degree, of course, we have antibacterial, but even from a virus perspective to the maximum possible degree. So I think you start seeing that. You also start seeing more kind of air purifiers in terms of like the disposable air purifiers for back seats. So these kind of things also starting to be utilized. You will start seeing different fabrics being used. So the fabrics that are currently utilized also, we will start seeing antivirus or antibacterial kind of fabrics that are starting to become more regular standard practice in terms of vehicle design. In a lot of public transportation or shared mobility, you will start seeing separators becoming more common. But of course, even in terms of the separators, of course, you need a special design. For example, air-conditioned vehicles require even a proper tube in order to get the air from the front, even into the back of the vehicle as well. So you start seeing this in terms of purely the hardware. And then on the software side, of course, as you know, more and more vehicles are connected. So you will start seeing more of these connected services that allow the vehicle to become more integrated with, for example, contactless area, payments, these kind of things, especially for shared mobility going forward. So I think this is what you will typically see in terms of design of the vehicle itself.
Thanks a lot, Pras. So with this, I'll take questions which people have been posting. So let me first ask Mr. Ajay Seth one question, and which has been posted but also been coming under discussion, is the whole issue of air condition operation and the fear of virus spread, and Metro being the fully air conditioned services. So is this fear legitimate? And if so, what is our Metro companies planning to address this issue?
See, that is certainly a concern that we do not have a full handle on air conditioning at a large public spaces. As far as our underground stations are concerned, by taking in more fresh air and what we normally do, we try to reduce the risk of or the circulated air gets reduced. But coaches are limited one. There we can't increase the fresh air beyond a point. So their use of a better filters to be done into HVAC systems which are there. So that's one area. In fact, CPWD has come out with certain guidelines on air conditioning, but those are basically for offices, not for large public spaces. So in fact, that is one area where we don't understand. In spite of people having a mask on, what will be the impact if one person is impacted? But again, the point is, while we say social distancing, we are doing so by doing a tight control at the entry point. There are several ways where a person can be symptomatic, but one very clear sign is the person is running a fever, or a person is coughing, sneezing, and that is a visible distress. They are there. If the screening at the entry point is done, then that person, even if infected, is asymptomatic. An asymptomatic person infecting others, that number is pretty small. So by doing, this is not possible with bus service. As Mr. Chandramauli was mentioning, it is a difficult one. Metro has that advantage that because we do the gate control at the entry point itself, we can screen out people, passengers who have the visible symptoms, and at the temperature control as well.
Thank you, Mr. Seth. Pras, would you like to add anything on this, the air conditioning and the virus spread?
No, I think it's exactly as Mr. Seth mentioned. I think right now in terms of HVAC related, there are some guidelines that are coming out. For the vehicle itself, already now there is more innovation that we see. If you see what is being done both by maybe the makers of vehicles as well as in terms of after sales fitting, there are these new charcoal filters. There are more kind of purification related nano-E technology or plasma cluster technology. These kind of things are starting to become more common, and you will start seeing it for larger spaces, for public transportation, these kind of areas. Of course, they're not perfect, but they do provide some degree of, additional care. But I mean, specifically in terms of public transportation, I fully agree with, again, what Mr. Seth was saying. The critical element is that they will start being far more in terms of at the access point. So temperature controls at access point, these kind of things will start becoming much more common in public transportation, whether it's airfare, whether it's in terms of trains. Buses, of course, become a little more difficult, especially in India, but you do see these kind of things also becoming almost part of the overall design of transport itself.
Thanks a lot, Pras. So let me come to Mr. Jyotilal. So there's a question which is saying that one way to increase public transport, especially buses, is by bringing in private sector. But there is also this whole issue of contact purchase versus stage carriage issue. So is the government thinking of engaging more with private sector to ramp up bus operation in the state?
Yeah, in fact, whether it is public or private, so ultimately you have to make it viable. So there are 2-3 things. One is a tax, as he said, tax, actually we exempted the tax. Just like a KSTU, we said that COVID time, the first quarter we have waived the entire tax for all the bus operators, including contract carriages. Okay, second part is how do you make, like in metros, non-fare box revenue you need to increase. So alternate mode of revenue generation. One is actually just now I got the call from Bosch, Bangalore. So what we said, the private number of vehicles increase. Naturally, somebody has to pay for it. Like we made Sunday as full lockdown. I think it's going to be maybe a major culture. Only in NMT and probably walking and non-motorized transport alone will be allowed say across the state. That's a good culture change. So maybe it will reduce because people are 24 hours, people are inside their house naturally or inside their compound. At least we can reduce the virus spread. So what we're telling, one is park and ride. Why people are not making use of the public transport? Because so you can't park the vehicle and then take a bus and then come back and take. So we give a monthly, you say 60 rupees. You can park your vehicle and then take the bus to your office or whichever place, and evening you can take. So park and ride is one thing which you're. Second is alternate modes of, in India, at least the roads are used mainly for parking, and probably at least in our state, probably Jada, Dharna, and whatever remaining space you can use for bus. So what we said, okay, this is a good business opportunity. Every parking, unauthorized parking, minimum fine is 500 rupees. 20 people you catch, you get 10,000 rupees, which is good enough. I can make the public transport totally free for the entire. So now ANPR recognition, number plate recognition cameras, which can, with artificial intelligence, by which you can detect 4 cases. One is bina seatbelt or the helmet without helmet, and then those unauthorized parking and zigzag driving. These 4 people, so I don't need an enforce. It becomes a bus itself becomes a moving police station. So anyway, I got the solution. Probably we would like to try it out in all public transport, including private vehicles. We will give that. Maybe we can share a revenue 50% or maybe 10% at least can be given to the operator. He gets an additional source of revenue. Second is, see, we carry almost 50 lakh people in the public transport, 50 to 60 lakh. That's a huge number. No, what is the core strength? This is a viewership, you are getting for maybe 10 minutes or half an hour or 1 hour when they are inside the bus. So actually today only I signed the notification. We said, anyway, we need to give COVID message that what all they should do, what they should not do. Maybe you can see in my room, I have COVID. COVID is a virus, but unknown enemy. But how do you fight it? You can't say it's like enemy is there. Either you fight or flight. So flight is social distancing and keeping distance, keeping yourself, but how many days you can keep? So you have to fight. The enemy, how do you fight? One is, if the virus gets inside, you take a steamer. Every time the virus should be out, keep social distancing, all the mask and everything. Then you improve your immunity power. That is one is vitamin C, iron, zinc, these are all the things which, with these messages, we need to give it in the bus. So what we said, we amended this thing saying that we can allow up to 60 decibel. That means I can put it, till now no audio was allowed inside the bus. We said, okay, all of you can put the ad, you get ad revenue. In fact, our gold jewelry, all these people are willing to put ad. I can put running a virtual channel, which is more than even Times Group. But I don't think anybody can get a first 50 lakh sure shot viewership in every day. I said a government's entire campaigning, whatever, I can give even any political party also. You book your slot, give your propaganda. I will. So this is I am running my own channel with the 4G. I talked to Airtel. Airtel said that they can put everything free, with the 4G SIM. Only the content creator that already we tried a pilot in Kochi, Technovia, one of the best of all the breaking news we get from the channel. You don't need another person to collect the news. We get through 18 channels in Kerala. So all the news of what is happening northeast, west, and south, all the news. Just compile, put breaking news, ad. So ad revenue is another thing which we need to look at. Then maybe fair integration. Someone was telling about this is another crucial. It's all whether it's a taxpayers' money, whether you put in the metro or in the public transport system. So ideally, that's why the one platform, just like a UPA or a BHIM. In fact, we are working with the Beacon, and the WRI is also helping us. You bring one solution for the entire country. Mobility, just like a UPA or BHIM. Now Beacon is working on it for each city. So you can have any number of apps. Let the data be with one central agency, with the government. So nobody owns the data, but the data is your privacy is protected. But you have one platform on which anyone can use it. So that individual operator also find it easy. He need not go for another another solution of his own. So this in a nutshell is, and one more thing I would like to say, which I think the thermal scanner, you're talking about the thermal scanner. I think pulse oximeter is what we require. If we know, there are two devices which can use. One is banned in India. That is, one is, you see, I was working on an AI platform with the General Electric has developed, but only thing, it affects the lung. How do you detect it? One is pulse oximeter, by which your saturation level comes down from maybe 90 to 50 or 60. That's the easy way. Or else you have got a portable X-ray, which portable ultrasound scanner, which probably it was banned. Otherwise, you can detect it even without having any of the RT-PCR or Gene Express tests. So I think last but not the least is what the Nissan CEO was mentioning. Japan is a good example. So only for public transport they will have the screening. Otherwise, it's you are allowed in your private space. Nobody is interfering. So public transport, what they did is you should have a Gene, like now we insist for all the flights which are coming from Gulf. We said you do one thing, let the airlines take the responsibility, tie up with the lab. You get a COVID negative certificate. Then why should I put all the restriction? You cannot have air conditioning. I think these are all maybe things which we need to think of. RT-PCR, private labs are there. All the pilots, we have been sending nurses to Gulf, 200, 300 and 500 nurses to most of the, in the COVID time. What we do, we ask them to do a test in the previous day, get the COVID negative, Gene Express or at least antibody testing. Then you allow them to travel just like what was there earlier. So I think this in a nutshell is my suggestions.
Sure. Thanks a lot, sir. I think one question is to Mr. Prasanna. It's more of an operational question. Is that when families are traveling with, let's say, husband, wife, children, in that scenario, how would you enforce social distancing in buses?
So actually, as I said, this all depends what kind of legislation we are getting. See, we have sleeper coaches. In sleeper coaches, you have 2 berths on one side and 1 berth on the other side. If husband and wife are traveling, whether we should give them that 2 berths or whether we should give them 2 single berths. That is a big question what we need to ask. So I believe if family is traveling, they should be allowed to travel together. But in India, when you allow something like this, people misuse it also. So we really do not know how to take care of this, whether they should carry their marriage certificate or what. How do you ensure that they are husband and wife? So whatever is social distancing norm, whether it is family or no family, we'll have to decide once that what is the norm, and accordingly then we'll have to follow. Because if you leave it up to certain class of people allowed to travel together and other class of people not allowed to travel together, then how do you ensure that they are at certain class or certain family? But I believe they should be allowed to travel together.
Sure. I think this is clear. The other question was assuming, so this was basically a combination, or maybe Mr. Ajay and Jyotilal can answer it together. And this was especially looking at bus transport and looking at feeder services. So can we also use this opportunity to developing integrated services where smaller form factors serve as a first and last mile to metro, and then the metro does the line haul, and because this will actually significantly reduce exposure of commuters to the COVID the pandemic. So is this something that we should start actively thinking more of an end-to-end journey planning using this COVID crisis as an opportunity?
Yeah, I think this is a great opportunity. Actually, we have got something called UNTA, Unified Metropolitan Transport Authority. We are planning somewhat like TFK. See, when you talk about citizen-centered governance, person wants to go from A to B. It can be various modes. You should be able to seamlessly go, and you should have probably fare integration comes. It is immaterial whether you use auto rickshaw or choice is yours. You use bus or you use any mode of transport. Your fare integration means per kilometer you have fixed a rate in the city. So this is ideal. What we are planning as transport for Kerala, the concept is that you put one common platform across everything, put a fare integration, point A to B, point you can choose which is according to your money value of time or time. So this is I think this is a need of the hour. Probably this is a great opportunity for us to introduce that system for all modes integrated into one, and have a one app or what is for each city or one state. So this is I think this is seriously, I think we should look into it.
Sure, sir. Mr. Ajay said, sir, do you also think something like this would work more actively, proactively now in Bangalore, especially the whole contactless, digital, and even paperless ticketing as one is looking at?
Again, when we say there are few things beyond our control, few things which are in our control, and anyway, that is a way to move forward. So one nation, one card, the NCMC, anyway, we were planned to go into that direction. It is better to rather fast forward it and bring it earlier so that the cash transactions at the metro stations can be brought to absolute zero. But we have to be clear about it that by doing so, we are excluding a good class which are yet not comfortable in using cards. So that is again, it is not equitable measures, but in the short term, perhaps that is a way to move forward. That is a measure, again, one of the specific measures which we have taken, the token sales and sales against cash, the recharge of the card against cash, we are not taking in this. At the moment, about out of 5 lakh commuters who used to travel on metro every day, good 3 lakhs were using card in any way. So when we are opening up, we are making it only in an online payment or to be done through the system. NCMC, anyway, we were planning that by December end, we will be ready with an NCMC card. So that's a way to move forward. Plus, the machines are also capable of the entry gates, wherein it is not the touch machine. One can show the card at a few centimeters above the contact level. So one contact can certainly get avoided there. So that is a teaching or the messaging to the public that these are the levels which can bring it down very, very specifically. So these are the ones which are certainly doable activities.
Russ, I think a lot of work around this has happened in Japan as well. And is there something that we can learn in terms of the integrated payment systems over there?
In terms of the integrated payment system, so I think naturally, initially, a lot of it was based on the certain agencies who had started the integrated, their own payment system. So you had in Tokyo, you had like the Suica card essentially for the railways. But then, as you know, probably in Tokyo, just taking the example of Tokyo, there are multiple companies. They're all private companies, but they had the same payment card that you're allowed to utilize the same card for all of these private companies. And then there is a fare separation system that actually allows each of them to receive what is their due. So there is that kind of a separation that actually does take place. But the next step of that was actually you could start utilizing that card when you go to a convenience store, so you could use it for your own payment. So it ended up becoming like a debit card itself. So it allows for multiple utilization. Of course, Japan's system is still essentially just a debit card with a minor benefit in terms of cost, but it's very convenient. But of course, if you're looking at systems like in Finland, where you have much more integrated payment systems, where you can buy a monthly pass, which allows you to utilize anything, where you get a significantly more benefit to utilize multimodal mobility. So I think there are different systems. The Japanese system is something that probably is what works mainly based on convenience. But maybe in India, what we need to do is not only convenience, we have to also then give a tangible benefit to the people for them to be able to switch and for it to make sense. But as was explained, maybe as Mr. Jyotilal said, you need like an UMTA, or you need an agency that is willing to take on that responsibility and not ensure that it becomes a silo issue, but actually creates a fair system that is best some kind of contribution system to allow everyone to survive effectively. How to manage private sector is another question that, however, needs to be dealt with potentially separately. At least begin with the public sector.
So let me just ask Mr. Patwardhan this follow-up on the private sector. As a chairman of BOKI and also as an operator, are you also looking the COVID crisis as to shift towards the digital payment for bus operations?
Absolutely. Everybody needs to shift to digital payments. It reduces leakage also. It is not only beneficial because it is contactless, but in a country like ours, it is very useful because it stops leakages also. So presently, private operators in multiple cities are already working on digital ticketing, not exactly, I would say, mobile-based digital ticketing, but with those machines. Intercity is already almost on the internet booking. So 80 to 85% of our bookings, they are online. So we are already digital in terms of intercity and intracity. So we would be very happy to participate in this card, which is a national mobility card. So it's a most welcome step and we would welcome it with whole heart.
Thanks a lot, Mr. Patwardhan. And I think with this, we are coming to close of the session. And before we officially close, let me just ask one round of final comments, stroke observations in terms of your perspective of public transport in, let's say, in 2021, if you have to have the same discussion next year around the same time, where do you think we will stand in terms of public transport? So let me just first ask Mr. Jyotilal and then we'll come to Mr. Seth. Yeah, if you can unmute, sir.
Yeah, sorry. In fact, by next year, we would like to have what we are planning is citizen-centric in the sense that you are able to book your ride, just like book my trip from point A to point B seamlessly through what's a digital platform. And I would like to have better conveniences so that, you give not the low cost. Low cost doesn't mean low quality. So don't compromise on the quality, improve this thing, but at the same time, make sure that they become viable so that they are able to give better services. Basically, citizen-centric governance using a digital platform. And I am very passionate about my reading is that the world is going to be a new world order when you shift from carbon-based to hydrogen-based or a low carbon, ultra low emission. I think that is going to happen. That's the age for India to become 5 trillion. It can become even 10 trillion. We should be able to have, that's why I was telling my concept is zero cash, zero congestion. That means urban planning and transport planning should get integrated. So third one is the zero congestion, zero cash and zero emission and zero waste. That means every waste can be converted into the fuel. In fact, we are working on the project biomass to hydrogen, electrolysis, solar energy to hydrogen. Ultimately, energy comes from the sun. We have to go back to the source. That is why I think all the elements evolved from the hydrogen, which is 1H1. Probably we need to get into the first, the source of energy. I think it is going to happen. that will change the world order. I'm sure India can be a powerful country the moment we shift our focus from the carbon fuel to hydrogen. All our import bill, your currency problem, everything will come. And in fact, Southeast Asian country, Japan, South Korea, and I think China has gone. We should catch up. I think maybe next year I want that we should have at least private bus or STUs, or the private buses should be able to run on hydrogen buses, so that you generate the waste. The local bodies have got enough waste, convert into energy, give them fuel free. That's what we are, my ultimate aim is. So I think it should happen within a year. Yeah, thank you.
Thank you, sir. Mr. Seth, your perspective of life next year?
Okay, I see our next 1 year is going to be very, very strong headwind, which metro companies and the public transport operators have to face. Now, there are few things which are beyond metro companies, but say within the transport sector, what are the things possible? And I take this idea from Mr. Patwardhan, when we said that there are government-owned, private-owned mass transport operators. This next 1 year, I wish we can utilize that time to look at how a much better coordination among these agencies can happen, because if mass transport, and I'm not seeing it beyond 1 year, will somehow the medical world will find a solution to this pandemic. So I'm just keeping it that headwind is for maybe for a year or maybe for 18 months kind of a situation. But the people or the agencies which are on mass transport business, they can prospect together, or each one of them will be operating at a very low-key operation. Just given one example, Tokyo moves 35,000 people per day per kilometer of metro. In India, we move 10 to 11,000, except Delhi, Mumbai one line. Rest of the metros are at 2,000, 3,000, 5,000 kind of numbers which are there. So there's a great scope that if everybody is cooperating and coordinating, then everybody gains there. So next 1 year, I'll see that between private operators and the public operator, mass transport operators, there is a coordination rather than an unhealthy competition with a sense of distrust. And I'll even put it, even the intermediate public transport also to get into that area, wherein there's a cooperative way of handling it rather than a competing and unhealthy competition kicking in.
Thanks a lot, Mr. Seth. Mr. Patwardhan, where do you see?
I think it is very important from future perspective that we should have coordinated and people-friendly economic way of traveling, so that people are attracted to public transport in secure fashion. While deciding this, I think 3 E's are important. One is we need to consider environment, what impact it would have on environment, whatever policy we decide. Second, what impact it would have on employment, so employment of the people. And third, what it would have on economy. So if we consider all these 3 E's, and in balanced way, if we decide what would be our future, then I think public transport has bright future going forward.
Thanks a lot. Pras, your insight for next 1 year.
Okay, thank you very much. So I think there are 2 things that obviously we're facing. The first one is the medical issue, which is about COVID. The second one is the economic issue. The medical issue, as also Mr. Seth mentioned, I believe the medical issue is something that with a vaccine, hopefully the vaccine comes out, the situation should somehow be controlled. But then beyond that, of course, there is the economic issue, and how do we survive with the economic issue, which also necessitates more utilization of public transportation. So actually what probably I see, if I talk about 1 year later, I try to look maybe into the situation in China right now. So if you take the situation in China today, actually public transportation is back at 95% of its usual levels. So the situation immediately during the 3-month period when COVID was a significant issue, naturally it went down, it was almost at nil. Immediately following that, there was a move where people said, I want private mobility rather than public mobility because I don't want shared mobility. But eventually also considering the economic factors, people started utilizing public transportation again. People kind of also need to move back into public transportation. The second thing that I also wanted to mention is the fact that I believe that there are certain behaviors that fundamentally change. Demand has changed. So of course you will start seeing things like more wherever it's possible. Of course, it's not possible for everyone, but in certain areas you will see more work from home. You will see these kind of things, which will also shift or change some of the demand patterns itself. So mobility will also slightly evolve from the demand and supply perspective, which needs to be considered. The third thing I would like to kind of maybe end on is the fact that I believe humans are very, very short in terms of their memory. It's quite short. So people will forget pain. It's like why people have childbirth. You know, it's second childbirth. The first time it's extremely painful. They say they never want to do it again, but then they want it again. So you do notice that people will forget this situation. People will get back to a kind of normalcy reasonably quickly once the vaccine is out. Of course, we have to keep, as public officials or people bothered about these kind of things, we have to take adequate care. But I believe the majority of the people will get back to some kind of sense of normalcy reasonably quickly. With that, I'd like to end my comments. Thank you.
Thanks a lot. And I think with this, we'll come to an end of an interesting 1.5 hour discussion. So once again, I'll thank Mr. Jyotilal, Mr. Ajay Seth, Mr. Prasanna Patwardhan, and two of our panelists had to leave early, Sahba Chauhan from Oak Foundation and Chandramauli Shukla from Dewas. So again, thanks a lot once again. That we'll share the recording of the webinar. And I think we had about 110 odd people participating during this course. So with this, we'll end. And I think this is the time to plan, to build better, because public transport is what cities need. And neither financially nor technically, we can have everyone moving personal transport. So public transport is the way forward, and hopefully we will get back to, or even better, as we were before the COVID times. So with this, we'll end. Again, thanks a lot for everyone participating. Thank you so much.